Is AI a friend or an enemy? Do the benefits outweigh the risks? Hello everyone, I am Sir Nurmal, a young Islam from Afghanistan and a PhD researcher and a lecturer at Heidelberg University in Germany. And my friend...
Hi, I'm Dr. Ellen Cosgrave, an Irish Public Health Registrar working with the Irish Health Service Executive.
I welcome you all to this very interesting discussion. We are very privileged to have Dr. Ricardo Baptista Leite, a great and highly inspiring personality, specifically in the field of digital health and AI, to shed light on a very pressing issue in the healthcare system, the digital health and the AI. So, could you please shortly introduce yourself to the...
Sure. So my name is Ricardo Baptista Leite, as you've mentioned. I am the CEO at IDARE, the International Digital Health and Artificial Intelligence Collaborative. We will be changing names soon, so keep your eyes out for that. And I'm also the founder and president of Unite, the Parliamentarians Network for Global Health, which is a network of current and former members of parliament, congresses and senates in more than 100 countries around the world, having myself been a 4-term member of parliament in my home country of Portugal.
Yeah, thank you.
To begin, Dr. Baptista Leite, could you say, in your opinion, give some examples of applications of AI with the most potential benefit for population health systems?
Well, when we look at the potential of artificial intelligence, the truth is it's already been embedded in many of the health-driven technologies that we use today. And that is something that I think many people were not so aware of until the rise of large language models like ChatGPT. But for example, imaging technology that has been used for diagnostics has widely used artificial intelligence or machine learning over the last few years very intensely in health systems around the world. On the populational health side and on the preventive side, there are a lot of technologies being deployed and that are being used. I wouldn't say at a large scale, but there is potential there in the sense that one of the greatest challenges when it comes to population health is data collection, interoperability, being able to use predictive models to detect who would be the potential beneficiaries of early diagnostics, of early health interventions. And so the technology has some concerns and risks that we certainly will talk about, but it does have those potentials to really help us transform the disease-driven models and to fix them to become focused on health and well-being, which at the end of the day needs to be our goal, which is to lower the burden of disease.
Thank you very much. Okay, to flip the coin, there are debates going on the opposite side. Like lots of professionals are very concerned about the AI and they think there are lots of risks associated. What do you think? What would be the top potential risks associated with AI in the healthcare system?
So I'd say there is concern that is legitimate around artificial intelligence overriding human decisions and leading to decisions that are not accurate or that lead to more harm than benefit. And that needs to be our principle as physicians, as healthcare professionals. First, do no harm. We learned that in first year in medical school. What does that mean actually? It means we need to mitigate risks. We need to make sure that the benefits outweigh the risks. We've done that with medicines and we've done that with medical devices. We've used randomized clinical trials. We've used different health technology assessment approaches to address this. Artificial intelligence should be no different. And this is an area of regulation that IDARE is highly committed to. But if you look at the potential risks on that front, I would say that if we ensure that the humans maintaining the loop as the final decision makers, we should look at artificial intelligence-driven tools as a support technology and not one to substitute humans at this point. Another huge risk, which is more structural, that goes beyond health, is the widening of the digital divide. Because the people that do not have access to the internet, do not have access to these technologies, do not have the literacy, well, they're further away from accessing these technologies. And so within countries, most vulnerable populations can be left behind, and between countries, low resource settings will be left behind. And so this is something we need to have a social contract at a global level to to address.
Thank you very much. And that brings us nicely on to the next question, which is where do you see the role of the WHO and the EU specifically in ensuring the safe deployment of AI within health systems?
Well, I think the European Union has really led the way in many aspects with the EU Act and many other pieces of legislation and regulation that are trying to address these challenges. And the World Health Organization, on the other hand, both in Geneva and in its regional offices, but also through a partnership that was launched just last July, a partnership between WHO, ITU, and WIPO, which is the Global Initiative on AI for Health, which are different organizations that are trying to bring together the different players and stakeholders and making sure that we develop the standards and the normative principles that we want to use to regulate and validate AI. This is something that I consider extremely important, that both the EU, WHO, and other institutions need to be able to do to avoid a fragmented regulatory framework across the world. But then when you have those laws, you have those regulations, and you actually have the validation processes defined, then you actually need to ensure that you're capable of implementing them on the ground. You need to make sure that you build the capacity in the regulatory agencies to go from high-level normative vision and view towards actually implementation. And that's where IDER is working to lead countries towards building that capacity so that we have that validation capacity, building up on the health technology assessment experience that we have in medicines and medical devices. I would say that we have here, since we're at Gastein, Europe has a huge opportunity here to lead the way, to avoid creating legislation that hinders innovation. So it's finding that balance, keeping citizens safe at the same time that we foster innovation and we promote an environment that allows these technologies to serve those that can benefit it from, at the same time that we're making sure that citizens are taken into account within their personal interests and the interests of the communities they live in.
Thank you very much. Like the final question as I got from your answers, that there are some ethical principles associated with use of AI. So can you tell us in short that what ethical principles should we consider while we want to integrate AI into healthcare? And overall, if you could say one statement about what is your vision about the future of AI in the healthcare systems?
Well, there are many principles that have been announced, a lot of variations. That's the first step. I think we need to standardize at a global level. We need to find a common agreement. There is an approach in that direction, I would say, with the concept of responsible AI. Some call it interchangeably trustworthy AI. And so you can actually find that in the literature already, what the responsible AI stands for. And it brings together many principles: fairness, inclusivity, accountability, transparency. All of these principles need to be incorporated within not only the deployment of AI technologies, but from the inception throughout the whole life cycle of the development of AI-driven technologies, these principles need to be present. So standardizing that definition is going to be a fundamental step towards then defining the methodologies through which we ensure that those principles, those ethical foundations, are always respected. And those ethical foundations at the end will be defined by the patients, by the citizens, but with a multidisciplinary approach. We cannot just have the technologists come on board with it. We need sociologists, we need anthropologists, we need the healthcare professionals, and of course the patients and the citizens, to make sure that we are using this technology to do more good than harm.
And your vision? What is your vision for the future of AI in the healthcare system?
Well, I can
say in one statement.
Yeah, so putting in a plug for IDEA, our vision is really to enable artificial intelligence-driven tools towards leading to constantly improving health and well-being outcomes in an equitable manner for all. And I think if we're able to do that, then we've accomplished our mission, and we've used technology to leverage us to the new era in which these disease-broken systems can actually lead towards health, well-being, and quality in life for all citizens and not just a few.
Yeah, thank you very much for your very insightful talk, and we're glad to have you.
Thank you very much.
Thank you.
Thank you.